Welcome, and thank you everyone for coming. We're really excited to have people from all around the world joining in. This webinar will explore lessons learned, challenges, and new approaches for inclusive early warning and response systems to build resilience in fragile and conflict-affected contexts. My name is Claudia. I am Head of Health Warnings Research and Innovation at the UCL Warning Research Center, and I'll be your moderator for the day. I first want to thank Irish Aid for sponsoring this event, and GOAL, the RAND Corporation, University College of London, and the Harvard Humanitarian Initiative for hosting and organizing it. So a few housekeeping notes before we start. Please use the chat to introduce yourself, share links or resources, or make comments. If you have any questions for the panel members, please make sure they are posted in the Q&A bottom. If you want to continue the conversation, use the hashtag Crisis to Resilience or C32R. As you may be aware, this year has had significant focus on the Early Warnings for All initiative, launched by the UN Secretary General, Antonio Guterres, who announced that every person on the planet is to be covered by an early warning system in the next 5 years. This Warnings for All initiative is vital to help enhance the power and effectiveness of warnings, but it's also an opportunity to make sure that inclusivity is part of the process of Warnings for All. So we can make sure that those who are marginalized or require specific or adapted warning systems are included. Of course, this is nothing new in the context of the Sendai framework and Target G, but it is important that it is integrated as part of the process. And this is what we're here to discuss today. So first, I would like to introduce a video from GOAL, the humanitarian organization, which directly shows the experiences from communities protected by early warning and response systems.
Hacer mi café. Ay, hacer mi café.
Mi nombre es Mercia Rosario Munguía Cáceres. Vivo en la colonia Nueva Providencia, pertenezco al CODEL de la colonia. Pues nosotros aquí en la colonia, antes, cuando no teníamos el sistema de alerta y acción temprana, pues era una catástrofe en la colonia, porque cuando llovía, las torrenciales, pues salíamos a la carrera, desesperados. Y aquí cada quien rezaba por su santo, pero ya luego que fuimos orientados, nuestras vidas cambiaron, la imagen de nuestras colonias cambió, porque tenemos la capacidad, gracias a Dios, tenemos la herramienta para poder accionar, más que todo, poder colaborar. Ya no salimos a la carrera como antes porque estamos capacitados. Pues nosotros tenemos aquí un aparatito, le decimos pluviómetro. El pluviómetro se lee 2 veces al día, una vez en la mañana a las 6 de la mañana y la otra a las 6 de la tarde. Tenemos un folleto en donde anotamos, hacemos el conteo del agua y, como le decía, estamos capacitados a saber cuándo tenemos que accionar, más que todo. Nosotros estamos contentos, ¿verdad? Porque al menos tenemos una forma de prevenir los accidentes en las cuestiones de las lluvias. Por ejemplo, cuando llueve bastante, nosotros ya estamos alertas, más que todo, a escuchar los noticieros, a recibir las llamadas telefónicas, a dar uso del radiocomunicador y todo eso, porque en la alcaldía ellos también están siempre pendientes de nosotros.
Este es un sistema de alerta. Aquí le pongo el pie y luego todo depende al tipo de alerta que esté aconteciendo.
El CODEL de la Nueva Providencia, gracias a Dios, se mantiene. Los jóvenes siempre están, ellos no son renuentes para nada a las reuniones. El señor presidente tiene voz y tiene autoridad para estas cuestiones, al igual su servidora y las demás personas.
I guess while we wait for the slides to reappear, I can start introducing the speakers. So first of all, we have Tracy Hart. Thank you for coming. She's a senior environmental specialist with the World Bank's Environment and Natural Resources Global Practice. Then we have Jordan Shannon, co-founder and chief medical officer of Stemma. Then we have Gabriela Padilla, actually, program director of GOAL in Honduras. And then Laura Peters, which is a postdoctoral research fellow at the University College of London. Our panel of experts will draw from years of experience and lessons learned from the field to answer the following questions. So why inclusive early warning systems? What is working or not when applying early warning systems? And what new ideas or approaches can be applied for inclusive early warning systems? So first of all, I would like to introduce Tracy Hart. Previously to her current position, Tracy Hart was a senior environmental specialist with the bank's Middle East and North Africa region. She also worked in the environment anchor for the bank's Sustainable Development Department for the Water Resources Management Group for Central and Western African region, and in the bank's Water and Urban Unit. Tracy has 15 years of work in the World Bank at the nexus of water and the environment, including wastewater treatment reuse, water quality management, groundwater injection and recharge, wetland conservation and rehabilitation, integrated ecosystem management, based on hydrological systems and environmental impact assessments. It's good to have you here today, Tracy. I pass the voice to you.
Thank you so much for that introduction. And welcome to everyone. I see we have participants from California, from Bangladesh, from Somalia, Mali, Ecuador, all the way around the world. So welcome to you all. I want to be able to set the stage here for why inclusive early warning systems matter. And I want to set it in the stage of why they matter to me. In this slide, you can see that I've been working on the issue of defueling conflict in terms of using environmental and natural resource management as a pathway to peace. So I work in fragile and conflict states, and I work on the use of environment and natural resources to foster conflict prevention and to strengthen resilience in fragile and conflict states. And so why it matters for me is that, of course, prevention is much less costly than post-disaster cleanup, for one. And number two, because whether disasters are man-made or natural-made, due to people's capacity to react, oftentimes disasters and conflict make richer people richer and poorer people poorer, to be very general about this. So we want to make sure that we are not increasing inequities in responding to disasters. Next slide. So as Claudia mentioned, the Sendai framework for disaster risk reduction was a major step in setting what is a people-centered preventative approach to disaster risk that really began to set the stage for early warning systems and who is considered to be kind of in inclusivity in terms of that definition, and how all sorts of countries, development organizations, NGOs, civil society groups might get on the same page with respect to addressing a framework for inclusive early warning systems. You can see here that the Sendai framework identifies women, children, and youth, elderly, people with disabilities, migrants, ethnic minorities, and indigenous peoples as those who might be particularly vulnerable. Next slide. So with respect to the World Bank and our work, I wanted to give you access to some resources that might help you as you seek to integrate inclusive early warning systems into your own systems and your own work. Here's two baseline resources that I would recommend. The one on the left is Inclusive Approaches to Disaster Risk Management, and it's a review of the literature, both within the bank but outside the bank. And on the right-hand side, it's a specific reference to existing evidence with respect to gender dimensions of disaster risk and resilience. Next. So in order to kind of place the vulnerable with respect to what constraints they face, here's one potential framework of viewing it. So you can see that there's fiscal or financial constraints, physical constraints, information constraints, attitudinal constraints, and institutional constraints. And so, for example, widows and rurally employed men might suffer for financial constraints, but also information constraints. That those who have physical mobility impairments might suffer physical constraints. That older persons might suffer attitudinal constraints. Also, perhaps minority groups might have attitudinal constraints with respect to lack of trust in government and authorities, et cetera. So this is one way of segmenting and beginning to move towards how you might address these constraints. Next slide. So if you go into these types of constraints now, you can begin to see what the examples of these constraints might be in terms of inclusive disaster risk management. And when you look at this, you can begin to understand, I'm not going to read through this all, but in terms of addressing physical constraints, that this might involve construction, infrastructure, housing, municipalities, urban facilities, the concept of universal access and universal access design. These are the types of water and sanitation. These are the types of institutions that would be involved in addressing physical constraints. Similarly, with respect to financial constraints, you can see that you would start to look at banks, perhaps micro lending, community insurance, access, and adaptable social protection programs, and other ways of beginning to find some inclusion to financing potential early warning systems or potential abilities for those who are most at risk to be able to, on the margin, prepare for disasters. With respect to information constraints, a lot of this is via communications and public sector government, specifically information programming, social media, but also through non-governmental actors who may, in particular areas that have to do with the vulnerable, have better access to those who may not necessarily trust the government. Next slide. So just to go on, you can see types of constraints, attitudinal constraints, and institutional constraints, again, where you might begin to see examples of particular constraints to inclusive disaster risk management, including early warning systems. And if you are to kind of look through these as a checklist to see, is this, does this particular example of a constraint exist in your project or in your neighborhood or in your community, this will begin to unravel what you might have to do to address those constraints. Next slide. So here are some priority areas and recommendations for inclusive disaster risk management that have been defined by my colleagues at the bank. This is just a subset, but it sets the stage for where you might begin to see, is this a priority for the communities you serve or the areas where you work? These areas of priorities and recommendations include how to better look at risk-informed decision-making, including specifically social registries of those who might be economically disadvantaged or even physically disadvantaged, and taking care in those social registries to make sure that this data information is not used for other purposes. Looking at reducing risk in construction, looking at financial preparedness to help manage climate shocks and disasters. Next. Strengthening disaster preparedness systems themselves with a keen eye to inclusivity. And you can see here that this would include including people with special needs in disaster preparedness training, in not only the training, but the design and preparation of the training, understanding how marginalized groups respond differently to disasters, understanding what blind spots governments might have with regards to what groups might be excluded and how to bridge those gaps, prioritizing restoration of essential public services for vulnerable groups, because those who are advantaged might have access to private resources, and those who are vulnerable might not have similar access to private resources, and making sure that shelters and public spaces are adequately designed for privacy for women and for space for women and children in the case that one needs to provide shelter space during disasters. Next. So I just wanted to give you a couple more resources that might be useful to you. These are guidance notes for good practices and resources for developing. On the left, you see disability inclusion in disaster risk management operations, and on the right, social inclusion and gender with respect to not only disaster risk management, but climate's resilience. Next. And I also wanted to say that we also have regionally specific resources. I found two here. One is on inclusive resilience for South Asia, and another one is gender responsive preparedness and recovery in the Caribbean. But I'm sure that there are others, especially those that go beyond what we offer at the World Bank. So I wanted to, again, set the stage for those who are presenting after me, and just to let you know that what we do in the World Bank in terms of inclusion into with respect to early warning systems covers the gamut from universal access design, stakeholder participation, the use of social media for alternative communications, making sure that this is a aspect of how we approach diversity and inclusion, and that this eye towards inclusive early warning systems is present in almost every sector of technical work that we do at the bank. So thank you for your attention. I'm looking forward to the discussion. And I send this back to you, Claudia.
Thank you so much, Tracy. That was a great presentation. I think it really gave a good overview of the different aspects that are involved in creating and evaluating whether early warning systems or different systems are inclusive, and also how the diversity of aspects involved and how they change, depending on the population. I imagine you don't consider the same things. Our next speaker is Dr. Jordan Shannon. She is a feminist, medical doctor, and global health academic. Jordan is also co-founder and chief medical officer of Stemma. She is based at the Institute for Global Health, University College of London, where she leads research in health systems, intersectionality and gender, planetary health, and participatory research. She's also worked in various settings, including remote indigenous Australia, post-tsunami Sri Lanka, the Peruvian Amazon, Western Kenya, and rural Sierra Leone. Hi, Jordan, it's great to have you here. I give the voice back to you.
Thank you, Claudia, and thank you, everyone. It's great to see you all online. First of all, thanks so much for having me. I come from a health background, and I'm Australian, and I want to sort of talk about those two things as a way of introducing sort of the journey to understanding and working with early warning systems. And so it's customary for many Australians to begin a presentation by recognizing Indigenous people in the land on which we grew up, which remains unceded. And I grew up on Yagara country, and I learned a lot from Indigenous elders, Yagara, Waka Waka, and Jawan in particular. And from listening and learning very early on in my career as a medical doctor, I gained this sense of respect about relationships between individuals, between communities, between people and non-human beings, between us and our environment. And I've tried to incorporate that in this journey that I've taken across the world. So since then, I've traveled from Australia across into Peru, up to Kenya, and then made my way to the UK. And I guess today I'm much newer to the field of early warning systems, and I guess I'm presenting as a way of learning and reflection this journey. So our journey really through Stemma, and Stemma is an organization that I'll introduce in a moment, has moved from strengthening health systems to experimenting with how community-led approaches to health can really start to embody and incorporate aspects of early warning systems that really cut across climate, health, and social systems. And COVID was really a turning point for us. The world is moving towards much more volatility, uncertainty, complexity, ambiguity than we've ever seen before. And COVID really sort of drove that home for us. I think in health and development, we're quite good at addressing things in silos. And so we tend to sort of allocate responsibility for disasters to a very separate group of people than those who do other forms of health work, whether it's maternal and child health or health system strengthening. And I don't think we can do that anymore. Disasters are no longer something that can be dealt with in that way, and that it should be, we should actually, although we don't really know it yet and we don't do it that well just yet, it's a universal reality that we should own. And so interestingly, Claudia, you mentioned Antonio Guterres's comment about universal coverage of early warning systems. In health, we talk about universal health coverage as well. And so how can we move towards that? How can we be embedding this type of thinking into health programs? And how can we own this type of approach in the health community more generally? So next slide, please. So Stemma, we are a group that bridges research and action, and we focus on community health. We look at health system strengthening beyond the bounds of a hospital and much more using community resources. And by doing this, we're really explicitly at the intersection between climate, health, and community. We work with communities where there has been a confluence of challenges, whether it's geography, politics, economic factors that place communities under extreme pressure and impact their livelihoods and health simultaneously. And in order to really address this confluence of very, very complex factors, we use a combination of systems, design thinking, asset-based approaches to really build community health resources in a systems-based way. So I guess our work challenges this concept of low resource settings, in that every community that we've worked with, and some of them are highlighted on the map, I'm going to talk to you about them in a moment, there are always resources. They may not always be stable, and they may not be arranged in an ideal way, but there's always been a volition and a creativity in the community that we have been really hoping to continue to build solutions to serve that need. And so we work with technology and quantitative data approaches, but we bridge that with community and participatory action. And over the course of working with communities, we've realized that we can't simply continue just to work in one particular domain of health systems, or even at that sort of climate and environmental nexus, that there has to be evolving strategies for making decisions in this volatile and complex and uncertain world. So I'll talk you through this journey using some of the locations that we've worked in. So next slide, please, or next bit, please. So first of all, we started our work, we'll just do, put as many as you want up there, but first Peru. We've done a lot of capacity building on the Rio Napo, which is a tributary of the Amazon. We focused on essential medicines, but this work has been impacted by floods, crop failure, food shortages, COVID, earthquakes, wildfires, and that occurs on a background of political instability. So even though we were there under a very different purpose, it's very difficult to ignore the disasters that were sort of happening in slow motion all around us. Sierra Leone, we focused on maternal and child health and health systems, but of course there was background to of other sort of forms of natural disasters, as well as Ebola, internal conflict, as a sort of very close history during the time that we were there. South Africa and peri-urban Pretoria, we were affected by water shortages and rolling power cuts when we were working with youth with HIV and supporting their mental health. Kenya, and I'll focus on Kenya in a little while. Currently, some of the communities that we're working with, so we're across Kisumu and Baringa County and Nakuru, and around Nakuru and up into Baringa, there's really severe droughts that are impacting the work that we're doing in health system strengthening and maternal and child health. Australia, extreme weather, heat waves, droughts have really impacted how we lead our systems-based approach to developing the social determinants of health from an Indigenous informed approach. And India, who's a partner of ours through a translocal health project, which I'll discuss in a moment, have been severely impacted by things such as COVID, farmers' strikes and environmental challenges. So by working in these areas, my point is that we are sort of reluctantly thrust into owning the fact that actually there are so many forms of disasters that require this embedding of an early warning thinking approach. So thank you. Yeah, moving on. One of the things that we did during the COVID pandemic was that we ran and got funding for a project called Translocal Health, which was beyond Stemma, but it's relevant here, in that the suprasystems risks of COVID, climate change, politics, capitalism, what have you, have these really highly localized nature of impacts. Yet at the same time, the type of responses and localized knowledges that we were able to connect in a network, a systems sort of network across the world, were surprisingly similar. And the creativity, as I said, that came from that was incredibly inspiring. And so it made us think about what really inclusion means when it comes to inclusive early warning systems. Beyond thinking about sort of different forms of constraints, what I want to introduce to you now is a sort of different way to think about how decisions are made, and to make that explicit through a very simple 2x2 framework. Thank you for putting that up. So we can think about information flows and mechanisms here, and so whether information flows from the center out, so like a top-down approach, or from the periphery in. We can also think about mechanisms in relation to whether they're centralized or decentralized. And so what we tend to see in the world of health and development is this very centralized response of policy making, information flows, where a policy gets made in a particular arena and then sort of gets disseminated outwards. Whereas what Stemma is focusing on, which I think is really important when it comes to early warning systems, is almost the opposite, where you have decentralized networks of community groups that are organizing, whether it's self-organizing or networking between themselves, and that the information may run towards the center, but may also be really important to keep the information dispersed and distributed at that level, at that scale. And so I've put early warning systems in sort of two different boxes here, in that I think early warning systems can probably be really interesting, really important at channeling information upwards for decision making, but at the same time are equally as important, as that video highlighted at the start, for making decisions at that right scale in that right place. Next slide, please. So this idea of right scale approaches is something that we work on, where in Stemma we're trying to bridge technology-enabled decision-making with community-led data and decisions. So we're basically trying to move from just a localized approach to a networked information and action approach. And we're also trying to bridge this divide between a very, very sort of local participatory qualitative data collection to something that can actually be useful and scaled across settings. Next slide. So it is a bit busy, and I won't talk too much through it. Just to give you a sort of high level overview of how we kind of approach decision making and complexity, and how to link up tech, community, decision making, and network it across. So stage one essentially focuses on making sense of complexity, so identifying local resources, creating that structure, and visualizing it back with the community. Stage two is more about linking results with global indicator sets, and as an aside here, our experience of locally informed data and metrics aligns generally really well with other global indicators, aside from the fact that locally informed indicators are able to pick up local knowledge and local community systems in ways that other indicators aren't. We also look at identifying ways to measure and report locally, and so whether that's using smartphones, if the smartphone's available, social media, and what have you. So looking at the right fit of information gathering that can be done. So it might be that a simple photograph is as good as a very, very burdensome survey. So looking at sort of streamlining that data gathering. And then priority setting. Stage three focuses more on decision making to action. So I think it's good to map out, it's really important to map out these challenges, but actually making sure it's linked to the right scale of action here is essential. And so we work with people to do a political economy and stakeholder analysis. And we use our systems mapping approach to identify pressure points and then entry points for action, based on what is a review of best evidence in that context. So I'll probably move to the next slide and explain a little bit more about pressure and entry points and how we're sort of playing with that. So we've just started to make these inroads into early warning systems and what that might mean when it comes to systems-based approaches to health. And so what we have when after this process of gathering and making sense of this complex data at the community level is that we have a map that shows us what builds positive health. And so what I'm talking about here is not prevention of disease necessarily, but more akin to resilience in disaster language, I guess. So positive health, that things that build people up, their livelihoods, their well-being, their ability to respond to act, their agency. And so we have maps that are community specific and then more general. And this is an example of a map that we built with Mama Kenya in Baringo County. And so through this mapping exercise, we can identify pressure points, which is essentially based on the pattern of data and the confluence of certain feedback loops in the system. But we also have entry points. So entry points are slightly different in that they are the things that are politically feasible to act on at that point with the current situation that's occurring on the ground. So when it comes to early warning systems, the thinking that we've been doing is looking not only at the pattern recognition of the system, but also working with the community to identify in these pressure points the perceived importance of different resource sets, their availability, and their agency that the community actually has over the particular set of resources. We're also looking at the changes to resource sets over the time. So what we have realized in some of our community partners is that the most important and challenging sort of sentinel indicator here is when something that has been considered stable moves to being an unstable point or set in the map. And so so communities who are used to dealing with certain fluctuations of certain resources, whether it's water or agricultural resources or health for that matter, communities have adapted to that in a different way to where a type of resource that has been taken for granted then becomes unstable. And then we're also thinking through depletion versus renewal. So as opposed to just mapping the depletion as an early warning signal, we're looking at ways in which that same pathway can be turned on its head towards regenerative approaches to building resilience, as it were. So I think what our general process here, and what I guess my final thought in this process is, like, because I'm not a disaster person by training, I'm thinking really about what this term early warning really means, because the interface, at least in these communities that I'm working with, the interface between prevention and regeneration and resilience and adaptability is very blurred between early warnings. And I think what we can pick up as an early warning sign, you know, in some of the communities that we've worked with, like that almost is too late. And so that interface between prevention and early warning is something that we're also working on too. So I'll pause there and hand the floor back to the team. And thank you very much, Claudia.
Hi, Jordan. Thank you so much. It was a great presentation. It was really interesting to see how, you know, that system-based thinking was operationalized in the context of Stemma, and the importance of all these decentralized networks of information to empower the communities. And of course, like building the interface between the early warning and detection, but also linking those to prevention measures, because sometimes, as you said, it can be too late. I thought those were great points, and we had a lot of conversation in the chat about those. So moving on, I would like to introduce our next speaker, Gabriela Padilla, which is the program director for GOAL in Honduras. She has 16 years of professional experience in design, planning, and implementation of resilience disaster risk reduction, biocommerce, natural resources management, and sustainable economic development programs. With strong analytical and adaptive management skills and a deep understanding of sustainable economic development and related organizational development. Hi, Gabriela, great to have you here today. I pass the floor back to you.
Thank you, Claudia, and a great presentation for Jordan and Tracy. So hi, everyone. I am sharing with you today the resilient and inclusive neighborhood approach. This approach includes a guide to address inclusive early warning and response systems in informal and urban settlements in contexts affected by violence. Next slide, please. The Rina is part of GOAL's crisis to resilience framework, and I will provide a quick overview of GOAL's theory of change. The crisis to resilience framework has been developed through a comprehensive investigation and analysis of our programs in the world's conflicts and crises, and this framework has been validated externally with the support of the Harvard University. So this framework reflects on how the global megatrends are leading the way to the humanitarian crisis. And we're going to read it from the left to the right, so these global megatrends includes environmental degradation and climate change, conflict, demographic change, economic fragility, migration, accelerated urbanization, and technology. So based on these analysis, GOAL has prioritized for action 4 of the main world crises: sudden onset emergencies, health crisis, food and nutrition insecurity, and migration. So when this crisis collapses the social economic systems, and if those crises aggregates one over the other, the adoption of negative coping strategies becomes cyclical by vulnerable communities. So GOAL understands that the severity of the human crisis differs based on the capacity of the local systems to respond. So this means that no matter how fragile the local situation is, there is always some kind of system functioning at local level, either underperformed or performing well. So this is why this framework is founded in 4 pillars, and one of them is a system approach. The other one is localization, adaptive management, and the governance and assurance framework. So finally, this framework aims for poor, excluded, and crisis-affected population in fragile contexts and conflict-affected contexts have increased access to life-saving goods and services through resilient and inclusive local systems. So in the next slide, we will see a representation on how the world is transforming into an urban society. This has been accelerated in the last few decades due to the climate change, the conflicts, and the migration into the field, from the field into the city. Therefore, it is estimated that by 2050, 70% of the world's population will live in urban areas. So why Rina? Millions of people live in informal urban settlements. The problem is that this is happening rapidly and is exceeding the capacity of local systems, generating social exclusion and vulnerability to disasters. And this is exactly what is happening in the cities where GOAL is working, in Colombia, Honduras, Haiti, and Sierra Leone. And Rina is designed to address the global trends of rapid and unplanned urban expansion and allow local governments to implement strategies to manage this expansion and improve the resilience of inclusion of its citizens. So this approach has been designed to support vulnerable populations that live in precarious and informal high-end urban settlements, including the most challenging urban contexts with high levels of insecurity, vulnerability to disasters, and social exclusion. So for GOAL, these precarious and urban settlements are considered as fragile contexts, and this is mainly because they may experience fragility through informality and conflict through gang violence or armed conflicts. So what is Rina? So the approach supports local systems centered in the community design to promote linkages between stakeholders and better governance. It is also capable of providing rentable and scalable solutions that transform informal and precarious urban settlements in resilient and inclusive neighborhoods. It uses practical tools and case studies. It builds also alliances among multiple interested parties that can transform the neighborhoods and strengthen local systems. And well, the manual contains 32 case studies, 157 tools referenced, more than 15 tools with practical examples, and more than 22 additional courses or resources. So for who is Rina to be used? Rina is directly mainly to local governments that are responsible for the administration of the city, and in some cases, municipal associations that govern a larger metropolitan area. It is also for communities and community-based organizations who can inform the workers to transform their neighborhoods, and also for national and regional government agencies, academic institutions, the private sector, or civil society agencies. The manual also informs how local governments can collaborate closely with other interested parties who perform functions in the urban resilience and inclusion and promote alliances between them. The RINA has 4 main guiding principles. The first principle is that is community-centered. RINA is anchored in a geographically or socially defined community or urban neighborhoods as the coordination and implementation unit. It focuses on what works and has an impact in those urban communities. The second principle is partnerships for local systems. So the RINA seeks to understand and strengthen the links and the different interconnections with the broader socioeconomic and governance systems, which are essential for resilient and inclusive neighborhoods. The third principle is institutional strengthening and good governance. So the RINA focuses on building the capacity of local systems so they can lead the effective engagement with the communities and other key stakeholders like private sector, state agencies, civil society organizations, and other interested parties in the territory. And the fourth principle is that is affordable and scalable. And this approach has been designed to be feasible and scalable by leveraging the resources available to communities and cities from other sources, including private sector or other key stakeholders in those territories. So on the next slide, we're understanding how is RINA structured. So the manual outlines 30 practical steps to transform urban informal settlements. We can see in the center who RINA intends to benefit, which are the urban settlements. How? Through the principles that we just discussed previously. And then we can see in the next circle the 30 steps proposed by the approach. And each step can be adapted to the context of each city, and they are organized in 4 phases. So the first phase is preparation and initial assessment, where it introduces RINA to the city management. It identifies its relevance within the city and explores the capacities to implement the RINA approach by the different stakeholders. The second phase is organization and planning. These are all the necessary preparations within the local government and with the key stakeholders that will be participating in the process for the implementation of the RINA, including the community-based organizations and other community-based actors. And the third phase is the implementations, and this phase sets out a series of interventions to stabilize and strengthen the local systems for resilient and inclusive neighborhoods, in which every stakeholder engaged in the different areas will be participating. And the phase 4, adapt and scale, for scaling and replicating RINA at the city level, building back better and long-term adoption of resilience and inclusion. So what do we expect as a final outcome of this process? So this approach intends in first place to increase the resilience and inclusion to the target communities, but also to achieve the 10 essentials of the United Nations campaign, Developing Resilient Cities 2030. So this manual was created to be used flexible. It's non-prescriptively for those who apply it. So it can be adapted to pretty much every context. So there's one specific step dedicated to the early warning and response systems. In this step 16, there is a guidance provided on how to design and implement an early warning and response system. This manual describes the best practices, recognizing that the early warning and response systems are composed of 4 main components: the risk awareness, monitoring and forecast, communication and alert, response capacity of the different stakeholders. It also offers examples on how to increase inclusion in formal settlements in violent contexts. It also offers how to improve or co-design and also operate early warning and response systems in precarious and vulnerable contexts. And it also highlights the participation of the community actors, which we saw at the beginning, like Doña Mercia, also engaging with youth and local stores. So in the next, we will see the presentation of Laura Peters of the case study recently published that GOL has done in collaboration with Harvard, UCL, the RAND Corporation, and on the co-production of inclusive early warning systems. And this case study that will be presented by Laura is also found in the Rina manual. So currently the Rina is being implemented in 19 cities, including Africa, Latin America, and the Caribbean. And in Guatemala City, it was implemented by our partner, Global Communities. So I think that will be it. Thank you very much.
Thank you so much, Gabriela. It was great to learn more about Rina and also the guidance that it offers, and also the framework and how it can be used to build resilience and create these early warnings. I think we've had a really good combination of theory versus practice. That brings me to our last speaker for this evening. Unfortunately, Laura had an emergency and won't be able to do the presentation herself, but she's shared with us a video. Laura Peters is a postdoctoral research fellow at the University College of London, course appointed to the Institute of Risk and Disasters Reduction and the Institute for Global Health. She's also a postdoctoral research fellow at the American University in the School of International Service. Laura is also affiliated with Stemma as research director. Laura is an interdisciplinary geographer and peace and conflict scholar who researches how deeply divided societies build knowledge about and cope with and act on social and environmental changes and challenges. The goal of her research is not only to mitigate risks, but also to develop actionable strategies that support community health, strengthen social environmental sustainability, and build durable peace. So it's great to have her on video today.
Hello, my name is Dr. Laura Peters, and I'm a postdoctoral research fellow at University College London, as well as at American University. I'm delighted to weigh in on how to make early warning and response systems more inclusive through co-production. Conflicts impact how, when, and where disasters occur. Recent research has found that 58% of global disaster deaths between 2004 and 2014 occurred in the 30 most fragile and conflict-affected countries worldwide, and that disaster deaths following armed conflicts were 40% higher than in non-conflict settings. Conflict-affected populations are disproportionately exposed to hazards and experience inequitable disaster impacts due to their vulnerability. And yet, they are often left without adequate and sometimes any early warnings and other anticipatory actions directed at preventing, mitigating, and preparing for disasters. What this means is that we are leaving behind 2 billion people. That's about a quarter of the global population that lives in conflict-affected contexts around the world, according to the UN in 2022. We're leaving them behind in the actions that we know save and improve the quality of people's lives. The status quo is anything but inclusive, and it's unacceptable from a human rights perspective. Best practices highlight the importance of taking participatory first-mile approaches to early warning and response systems, with people positioned at the center. The people positioned to use these systems should be involved as partners from the first stages of agenda setting through all stages of knowledge production, monitoring and forecasting, dissemination, and preparedness. So this is already what we know. But what we don't know is how to tailor these approaches for fragile and conflict settings. For instance, those involved in formal governance may be unwilling or unable to meet the basic needs of their populations in regards to disasters, as well as anything else. Conflict-affected populations may be socially and politically excluded, not only from decision-making processes, but also in basic official monitoring and counting. Taking an all-of-society approach may point to the necessity of engaging with stakeholders that may be directly in conflict with each other. They may be perpetrating or affected by conflict and violence, and they may even benefit from the vulnerabilities that drive disaster risks. And finally, some risk-reducing actions may come at the expense of others or carry consequences that actually deepen vulnerabilities for the most marginalized. For example, through forcible displacement schemes from certain hazard zones into more isolated areas. What ends up happening is that anticipatory actions are traded in very often for purely reactionary forms of humanitarian support deployed only after disasters occur, or they are developed half-heartedly through top-down and limited approaches. Closing this action knowledge gap has the potential to guide inclusive, anticipatory disaster risk reduction for some of the most vulnerable and marginalized populations facing some of the most challenging conditions around the world. To help fill this gap, we conducted research on GOAL's more than 10 years of on-the-ground experience co-producing early warning and response systems in informal settlements controlled by territorial gangs in Tegucigalpa, Honduras. Honduras, just as a bit of a background, that experiences frequent as well as severe floods and landslides. One of the most extreme situations being related to Hurricane Mitch in 1998. About 52% of the capital city Tegucigalpa's population lives in informal settlements and is particularly vulnerable to disasters, in part due to extremely high rates of territorial gang violence, social political exclusion, and extreme poverty. Since 2010, GOAL has been engaging in the co-production of early warning and response systems through citywide initiatives, as well as through focused programming in these informal settlements, which are mainly located in the city's peripheries and along the river floodplain that experience the highest disaster risks. GOAL worked through a local systems approach by developing warnings and response capacities around core local systems, which they found can further enhance protections for at-risk populations. Core local systems are the ones that people actually contribute to and depend on to meet their basic needs, such as those involved in the provision of supplies, temporary as well as safer shelters, and social support. And these are necessary before, during, and after disasters. And so our research explored 4 main findings around the strategies that GOAL took around their local systems approach. Our first finding is that GOAL engaged key local actors based on their roles or potential roles within local systems, rather than taking the more conventional approach of engaging people based only on their belonging to a target vulnerable group. GOAL found that women and youth played particularly central roles in their communities, and so GOAL supported their capacity building to also play central leadership roles in the early warning and response system. This photo on the screen shows a woman volunteering to make door-to-door visits in her community to increase awareness of the risks that people live in, as well as increase their knowledge about the early warning and response system. They called them prevention preachers. And again, they worked in their own communities. And this work was significant in the context of informality and territorial gang violence, because this programming helped to empower those often victimized by violence, as well as repair relationships that were strained by violence. Goal worked to build upon existing local assets and temporarily filled in gaps where assets were lacking. Assets are sometimes in ill repair, destroyed, or missing due to informality as well as violence. And this challenges operationalizing a comprehensive early warning and response system. So Goal strategically placed monitoring equipment, such as rain gauges, in non-public spaces to reduce the risk of vandalism or theft. And another one of Goal's interesting strategies was to build playgrounds and other community spaces, such as the one pictured on the slide. They built them in vacant lots in high hazard zones with the dual objective of discouraging people from building homes there and also making spaces for positive community actions where there may not be so many public spaces available. Our third finding is that in Tegucigalpa, as elsewhere, governance is a hybrid mix of formal and informal structures. And so Goal worked to build cooperative systems of governance. And this is especially challenging in this situation because informal settlements face the reality of being excluded from formal city governance and services. And territorial gangs contribute to the complexity of the informal governance landscape. Capacity building was aimed at supporting informal governance, such as through community-based organizations, to co-develop and collaborate together with formal governance, as well as encouraging these more formal actors to make space for them at the table. This involved developing skills on both sides in areas such as conflict resolution and collaborative planning, and establishing very specific roles for everyone to play. And finally, local systems are dynamic and they change as the city evolves and grows. So programming was conducted to continuously reevaluate these baseline numbers, these baseline understandings, and adapt to changes to remain responsive and effective. Early warning and response systems need to evolve in accordance with this evolving risk landscape. High rates of in and out migration contributed to this, as well as territorial gang violence, contributing to sometimes rapid and unexpected changes in security. And some of these impacts, for example, are when in periods of spikes of violence, outside vendors at times temporarily suspended services that are in fact very necessary for the early warning and response systems to be operational. So by keeping local systems at the center of the early warning and response system, Goal focused on decentralizing the stability, which enhanced the self-sustainability of the work, in addition to conducting training of trainers workshops to keep up with these population changes. So to conclude, Goal employed a number of key strategies to address conflict and fragility within their long-term programming. From the very first stages of engagement, Goal has prioritized building trust and goodwill with all key stakeholders. And I want to stress that this is no easy feat in a context where trust is hard to win and extremely easy to lose. Early warning and response systems are only as strong as the social relationships and local capacities that support them, which necessitates building on the local capacities and assets that are already there and committing to long-term vulnerability reduction strategies together with all key stakeholders involved and taking ownership of this process. Rather than avoiding or merely navigating conflict, Goal addressed conflict and fragility head-on to ensure inclusive processes and outcomes truly in line with the ambitious goals of the Sendai Framework for Disaster Risk Reduction to leave no one behind. Thank you.
Thank you. I thought that was a great presentation. I really liked the point about how inclusivity and decentralized systems are important for the long-term approach and work and ensuring that there's sustainability. I think that came across very strong and very well. We're now going to move on to the Q&A section. As some of you may have seen, some of them have already been answered directly on the chat. So have a look. I would like to start with a bit of a specific question, I think for Jordan, on what is the role of ethical data and technology in early warning systems?
Thanks, Claudia, and great to kick off the Q&A. I've been sort of burrowed away reading through the answers, which I think are amazing. And so if you haven't read, you can actually see, if you go into the answers and read, Tracy, Gabriela, and colleagues have started to answer there too. So ethical data, I mean, this is one of the challenges that we've really grappled with. And I've actually, once again, been on this sort of transition between someone who's actually really a skeptic when it comes to the way that data has been used as an instrument of global health and development, to something that is actually highly has a realm of possibilities if it is done right. And I think the ethics that we've come up across when it comes to data gathering, and I sort of touched on it with one of my answers, but I'll just run you through them in a few different sort of general scenarios. So firstly, there is this sort of the extractive nature of systems of data collection that we currently have, especially this sort of the human element. So I think, you know, with maybe environmental warning systems, there is the ability to be a little bit more, the technical realm sort of can still exist. Whereas when it comes to health related data, when it comes to livelihood related data, we haven't done that well at all. And there has been a general sort of distrust between the sort of the community and the institutional level at the way in which that process has been operationalized in the past. And so the way that we're trying to address this is basically to develop a suite of different, you can call them tools, you could call them products, but basically that enables communities to go through the process of a participatory systems-based approach, but then to feed that into a decision-making platform that is tech-enabled, and then to use that to link into best practices to put that decision-making back into the hands of community members. Doesn't mean that it's without challenges. And I think the second challenge that we've come up across when it comes to this has been the way in which different groups of people are able to access the right tech and to be able to sort of do data gathering, as it were. So, for example, we were working on gender violence. I was working on gender violence in a different project with a group of health workers, promotores in Peru. And interestingly, they usually, you know, health workers are slightly gender balanced towards women, but these were a group of predominantly men. And so the type of information that they gathered and the way in which they gathered information was very different. So having this sort of different groups of people represented that I think all of the other panelists have highlighted. The other issue then that we came up across was when it comes to so if we're looking at streamlining data collection, so through photos, through social media, that brings up a range of different types of ethical questions around privacy, consent, etc. And something that Laura highlighted and myself in a paper around the link between GPS data and participatory data and the ethical frictions there. A situation that occurred in Australia was that when you have these sort of automated at scale forms of data gathering, such as GPS data, that can be in direct conflict with communities' wishes. And so in Australia, Uluru, which was previously known as Ayers Rock, has always been a sacred site, but has been the traditional owners of Uluru have requested that no one walks up Uluru, and that no one actually uses GPS to do the same in a virtual sense. And that's through a great respect for this as a cultural land-based symbol. And so there's always these tensions between sort of what we do at scale and communities' needs. And I think just making that really, really explicit and being able to really keep this human-centered design and this relationship-based design between humans and our environment at the forefront, it has been really important to us. So I'll stop there.
Oh, thank you. It's interesting, because in a way, tools are key to empowering communities, but at the same time, if you don't think about the unintended consequences of those, you can't really you may have, as I just said, unintended consequences. So it's good to think about the pros and cons, as you mentioned, and how to make sure that they're also like participating willingly and, you know, take that like all the benefits. I think I would like to ask a question just as a sum up that I think was really good on what lessons do you think have been learned about creating inclusive warning systems? I think that can be a question for all of you, but like if you could highlight one or two comments about this question, what would those be? I would start with you, Tracy. What do you think?
Can you repeat that? I'm sorry.
Of course, of course. So what lessons have been learned about creating inclusive warning systems? So what do you think are the key lessons that we've learned over time on how to create inclusive warning systems? Just like, you know, if you had like one or two big thoughts on this, what would those be?
Yeah, I mean, we're having an interesting conversation in the chat function about, and we have had it over the last hour, about potential biases and misuse of information and potential biases with regards to action and inaction. And so one of the lessons I would draw is that is to spread the risk in terms of reliance on one actor to provide either early warning or early response, because across central government, local government, international NGOs, local community self-help groups, each of these has their particular constituency politically, has their particular inroads in terms of being able to spread information and bring in information. And therefore, the broader of a platform we can have in terms of collaboration across partners, the better we will be able to bridge gaps or biases that any one partner may have. That's my biggest lesson. Back to you, Claudia.
It's a good one. Gabriela, do you want to add anything to this?
Yeah, one thing that I think is coming across is the importance of localization and the engagement of local actors. And I think one of the lessons learned more important is how early warning and response systems need to be co-produced or co-created together with the different stakeholders that need to be involved, and this includes the community. And within the community, key actors such as Doña Mercia, such as small stores that can provide a specific role in operating the early warning and response system, such as measurements, but also as a key important thing is the dissemination of the information of alerts during the emergency, or the dissemination of the information on how the early warning and response systems functions and operates. So I think one of the things that I would highlight is localization, ensuring the capacity of local actors, building local capacities, but also engaging with other type of stakeholders, that the engagement with the academia, how to professionalize and technify more early warning and response systems and automatize them with the collaboration of academia. And also, we don't want to forget the role that the private sector has. In some cases, private sector gets directly affected by emergencies, and they could be interested in investing to improve early warning and response systems. So that's my contribution to this question.
Thank you, Gabriela. I think it's really interesting how all of you highlighted the importance of not only engaging with communities in a way of like understanding what are their issues, but also to build top-down systems, but also empowering them to make the decisions themselves and to act themselves. And you just said the idea of co-production and, you know, the difference between participatory approaches and co-production. I think that's like a big thing that we're currently transitioning to in inclusive warning systems. So it's great to hear more about it and learn more about it. Jordan, do you want to add anything else?
No, I think Tracy and Gabriela just did such an eloquent job. I agree thoroughly with them.
To be fair, between like the ethical collection, co-production, and technology and private sector, I think they've covered very big themes already. So one question I think is interesting is, how do you generate impact-based forecasting that are inclusives? So how do you make sure that like in the warning messages you disseminate about like actions that will occur? How do you make sure those are inclusive and, you know, take on the whole population? Do you want to add something to that, Jordan?
That's tricky, but what I would say is a concept that Laura introduced that's really hit home for me, and I think this is something that our friend and colleague Ilan Kelman also uses, and that's his first mile approach. So instead of thinking about the way in which centralized information can be disseminated out, thinking really at the point of this first mile, this human that really and what their needs are, and one of my other sort of passions has been the arts, and we haven't really spoken much about it here, but what I've seen through a review of different types of arts-based approaches when it comes to disasters is something that really touches on what is human, and it allows us to cut through things like stigma and inequity really well in ways that other sort of more technical approaches haven't. So whether that's community theatre, whether that's radio, whether that's forms of poetry, what have you, street art, what have you. So it points towards or notions towards that centering of the human experience and the telling of a story that breaks down some of these challenges to inclusivity and equity that we're facing. Probably not the whole part of the story.
No, I thought that was really interesting. I think sometimes we get, in a way, really we get really focused on the technological aspects, but at the end of the day, traditional warning systems have been there for a long time. Some of them are through art, stories. And I think it's good that we think about those as well, how we leverage those when we tell stories to the community. Which I guess brings me to the next question that we'll just put on the chat, which is, what are some good strategies to build up public, local stakeholder knowledge of risks and hazards where there's a distrust or a lack of local authorities? I'm just gonna let that sink in. Gabriela, do you have any thoughts on this? Because I imagine through Goal you've engaged with a lot of local communities. It was great to hear about them, the video. So how do you think we can engage about like knowledge of risks and build trust?
Yeah, I don't think I got the question correctly. Claudia, maybe you can repeat it. I'm sorry.
Yes, of course. I mean, I think it has quite a lot of different aspects, this question.
Yeah,
so,
it's a little bit complex. Yeah.
It's in the chat as well.
Okay.
And in the Q&A, it's what are some good strategies to build up public, local stakeholder knowledge of risk and hazards? So the first part, I think, is more educational. And then the second part of the question is, when there's a distrust or a lack of local authority, so how do you build that knowledge or like that education, information platforms when you feel like the community, either doesn't trust the governing authority or there isn't like a top-down governance system?
Yeah. So risk knowledge is a key. I think it's a key component of the early warning and response system. Understanding the level of risks and the all the GSI information related, the scope of the risk within the territory. And to understand that risk, usually our recommendation is to be done in collaboration with different stakeholders. So a good practice that we have learned is initially understand the threat, the hazard, together with the communities, doing practical and participatory exercises to understand the affectations. And at the second level, get access to support from the universities on a more technified understanding of the hazard. And in this process, it's key the participation or the leadership of the local governments or the national governments whenever it's possible. So the Rina has a strong approach promoting that these processes, this design and implementation processes are led by national and local governments, and we as goal facilitate these linkages between communities, universities, and the authorities in the design and the implementation. This process can allow to build trust in the process as people are engaged in since the creation of this process in understanding the risk of the local territory. So with this approach, that's one way to begin to build trust. And of course, the information gets more accessible to the different stakeholders as they are building it in the process. I think that could be my answer. I'm not sure if I got the whole response for the questions.
I think it was interesting, bringing all these stakeholders together. I think also, Jordan, you answered a similar sort of question in the chat about how do you act when there's like negative responses to like international organizations coming in? What is your approach to this, or whether you see those things? So for whoever asked the question, I think there's an interesting answer about that also on the chat. Do you want to add anything to that, Tracy? Because I remember one of your slides was about risk communication. So I don't know if there's any way to improve risk communication in the context of inclusive warning systems. When there's lack of trust, how do you build, how do you ensure that like the messages are translated into action from the communication from the communities? How do you engage with them?
Yeah, I mean, this is a tricky question. I mean, my gut answer is that I like to separate the function of early warning data collection and analytical work in terms of forecasting as being areas, kind of public goods that the government and universities can help lead on, and then the actual early warning communications and immediate response as being areas where government is not the preferred actor simply because of trust issues, because of inclusivity issues, because of the unwieldy nature of government as a public institution. And so while government itself may be critical in early forecasting and predictive models, I think that looking at local institutions and community groups as being, and even kind of Red Cross, Red Crescent, in institutions that kind of have independent authority and independent trust mechanisms are probably those who are best equipped to actually do the early warning communication and immediate first response. Over.
I think it's a really interesting point. Also, like, there's no need to create a new system and reinvent the whole wheel, but maybe try and understand which systems are already there and you can leverage, and which organizations have already built in systems with those communities.
Maybe I would like to add to that, Claudia. Maybe one approach that is very useful in addressing this issue is the social and behavior change. So this approach tries to understand the main barriers for why people are not responding to the different recommendations coming from the early warning and response systems. And also this approach forces you to understand which are the main communication channels that people is using. So then you design a strategy on how to address those issues. This can provide you more reach to the population, and it can provide you with strategies on how to change behaviors, to promote changing behaviors by the population, the users of the early warning and response systems.
Thank you, Gabriela. That's a good add-on. We're unfortunately like running out of time, so I would just like to end with, I think the conversation really highlighted on, in a way, how inclusive warning systems not only like a political goal or about being politically correct, but about ensuring that there's early action that is more effective, that is sustained over time, and that is system thinking as well. think top-down organizations often are divided in sectors, and maybe there's harder time to communicate and think about issues more holistically, but communities are not that way in a way. And engaging them in the process is a way of understanding all the different risks they're involved and they're exposed to, and how they can be all integrated together in warning systems. So I think, thank you all for coming. Thank you for all the panelists to give their amazing presentations. I really enjoyed and learned through the process as well. And thank you for all the organizations that made this event possible, and for everyone who joined us tonight. I wish you all a good evening or good morning, wherever you are, and thank you.